Hello everyone, welcome back to a new video. This is Aurora, cabin practitioner and lifestyle coaching. Today our topic is shoulder pain and what is the best positions to keep your shoulder in a very healthy shape and healthy. Stay on till the end of the video. Here is the thing that you need to know for fact. If you are addressing the right problem, you get results. But if you are addressing the wrong problem, you will not get any results. So wow, this is really heavy. But you may be surprised that many people they tried for years to treat the wrong problem without getting any results. So you have to be willing to try something new and realize that what you are doing is not working, especially with shoulder pain. So I'm gonna show you the best position to sleep with your shoulder. In meantime, I wanna let you know that 80% of shoulder pain doesn't come from the shoulder itself. It has been referred, and the only reason I figure it out is being in a practice for years to think outside of the box. I'm going to show you very really great tips which based on years of trials and errors. Most of shoulder pain, it can be left side, mostly the right side. I'm talking about through up here. It can be the neck, from the neck, not necessarily a gallbladder, but I'm talking about a tube, which we call it as a duct between your gallbladder and liver. This little tube called bile duct, and that duct commonly it's plugged up with sludge and maybe with very teeny stone. Usually it's not. Usually it's thick sludge, and that pressure backs up to the liver and backs up to the diaphragm and cause pressure to something which called phrenic nerve. The phrenic nerve goes right up to your neck, and that nerve is irritated, cause the spasm into your shoulder, and even can cause the vertebra to rotate and pinch the nerve right into your shoulder, and it can happen to the left side too. So if there is a backup in the duct that goes in the pancreas, and also it can from the left side of your diaphragm where the phrenic nerves comes up into the same side. So if you don't know that and you are trying to fix your shoulder, you are doing therapy, you are doing exercises, and you're still wondering why my shoulder is not getting better, so guess what? It's coming from your diet. Because of carbs diet, because of refined carbs, because of omega-6 fatty acids. It can be a lot of nuts, it can be fried foods. So all these foods are irritating that little duct which cause the shoulder pain all the day. Here I will show you a simple way to know if your problem happened because of that duct. It's just a massage underneath of the right or the left rib of cage, 2.5 centimeter. Massage it softly and see if the shoulder pain disappear, at least temporarily. So if it does, the chances are that the pain is got referred from your digestive system. So I just wanna to bring this up first, and I want to talk about it as it's a common and hardly anyone knows about it, and it's easy problem to fix. You are going to need some bile salt and gallbladder formula. that will be helping to start to thin the bile and allow the flow of bile through this duct and eliminate the shoulder pain. The gallbladder related problem will cause tension in the trap up through here, and it can be also in the other side. Alright, let's say you are having a problem in your shoulder, okay, and you have arthritis in your AC joint or somewhere in your shoulder joint. So the best exercise is to find some pull-up bar and try to stretch. Initially, it's not required that you will pull up whole your body. You can just start with the right hand or left hand or both hands, okay, and stretch this muscle which called latissimus dorsis. So here you want to stretch the lat, and by doing this means the pulling up. By doing this, you are sending information to the top part of your muscle and allowing the joint, the shoulder joint, to open up for more relief. Let's say after dinner or before bed, for 15 seconds, whether weight bearing or not weight bearing, it will be helping to give a good relief to your shoulder and will be helping to have a better sleep. But here we want to work up a situation where we can hang our whole body weight and our hands on the bar forward for between 15 to 30 seconds for 3 sets, 3 times a week. In this way, if you can, you will be achieving that your shoulder gonna be in a good shape. And the other point I want to discuss here is about inflammation in general. So if you are having arthritis or inflammation in your shoulder, I just want you to remember what you had the day before. The chances are that what we have eaten yesterday, it may cause inflammation, and it can be dairy, it can be nuts, it can be carbohydrate. And my advice is to decrease the omega-6 fatty acid and increase the omega-3 fatty acid. Can be in fish oil, can be in olive oil, and this is essential. One of the best remedies, natural remedies I found for inflammation, it's called stinging nettle roots. It's really good for inflammations and especially for people who are having arthritis. And the best powerful vitamin that can help you with your inflammation is vitamin D3. If you get the combination between vitamin D3 and vitamin K2, you will get really very good combination, as vitamin K2 it takes the calcium from your arteries, from your joint, and put it back into your bones, and this helps to remove the calcium from the places where it shouldn't be. And as we know, the vitamin D is dropping a good to drop the inflammations dramatically, and both can be helpful and you will be feeling really good. So at least if we'll be taking, we need 20,000 units from vitamin D and 200 microgram from K2, and for every 10,000 units of vitamin D3 we need 100 micro of vitamin K2. If you are having shoulder pain during your sleep, just try to take those 2 tablets, 2 vitamins, and blend it right before your bed, and it will be really helping you to have a good sleep. Right now, let's talk about what is the positions which I must not use it or do it during my sleep. let's say you're gonna sleep in your side, either right side or left side, so you will be creating a pressure and weight on into your shoulder, and that will be feeling uncomfortable. So it's better to tuck your shoulder for a few centimeters, 2 to 4 centimeters, and try make sure that your head and spine are neutral. Means your head not too down, neither too high. That's avoiding the pressure to your shoulder. And it's worthy if you're gonna spend some money to buy a high quality pillow. Now, what about sleeping in the stomach? Really terrible. Why? First of all, we cannot hold our neck for 8 hours, either right side or left side. Second problem we can face is breathing problem, as we will be facing the pillow, and that cannot be possible. So by doing that, we are going to cut off the nerve supply to our bronchial plexus and nerves. So guess what? Those nerves are going to our shoulder. So of course, it's not advisable at all to sleep on the stomach. Other position is sleeping on the back with pillow or without pillow. Of course, it's not a good idea, because again it will be going to pinch the nerve and will be leading to shoulder pain. The best and absolute position I am recommending is to sleep on the side with the pillow, which is helping to make the head and the spine in a neutral position. The head must not be forward, neither backward, and in this way we are avoiding the pressure and the weight on our shoulder. Also, I recommend to use a roll towel or a washcloth and under the neck to give the support, and I recommend also to use a pillow between knees if there is no problem in the hips and the lower back. So thank you for watching. I'm blessed that you are listening and you are following our channel for more information and tips to be in a healthy lifestyle and to maintain our health in a good shape.